Well, hello, everyone. Welcome to the Heart of Innovation. Some people practice medicine because it's their job. Others do it because it's in their blood. It's who they are at their core. And when life changes the path, that calling does not disappear. It just finds another way forward. And today's episode is all about that kind of medicine. And I can't wait to introduce you all to Dr. Jean Chen. She's a retired podiatrist turned diabetic educator, and her story is remarkable. And you're going to be inspired by her journey, especially as she shares the life-altering moment that led to a career shift and become mission-driven. I'm here, of course, as always, with Dr. John Phillips. Dr. John, this is really one of those stories I think that reminds us that medicine isn't just a specialty, it's truly an instinct. And I think you demonstrated that just a few weeks ago when you shared a very personal story of that instinct, which drove you to actually save a life of a man in Ohio. And I don't know, for
Mhm.
those who
Yeah,
missed it, you might want to give us the Cliff Notes version because it was so powerful.
yeah. Happy Saturday, Kimberly. Your hair looks great, by the way. I love it. Remember, because you were a little worried about the during the cruise, right? It looks awesome.
Yeah, I
Um,
just got back from the cruise. I didn't know there was literally a hair Olympics, and this
yes.
guy from India won the World Hair Olympics. But initially, he died, didn't have enough time, and my hair was orange, so we had to go back for take two.
Right, and it looks fantastic. I mine
Thank
mine is
you.
covered with a hat from a town in Maui, which you were
Yeah,
just
keep it on.
yeah, definitely. I'll keep it on. Don't worry. Yeah, no, looking forward to the show because Dr. Chen's story is obviously very powerful, but it's not often we have the physician that's a patient too. And so, you're kind of straddling that line of she knows enough to be dangerous, but yet she has some of the risk factors for what we talk about all the time with peripheral arterial disease. So that's going to be an awesome conversation, and I'm really looking forward to it. But yeah, the story that I shared a little bit, it was one of those moments, and I'm sure Dr. Chen's had them where we find ourselves as physicians in situations where you have to make a decision and you're not sure
Yeah.
what the right decision is, and you just kind of go with your gut. And my gut was telling me to do something, and at the end of the day, it worked out really well, and it was kind of a Christmas miracle. So I'm really happy for that patient. Obviously, the family's happy, and I'm just glad that the team was everybody was pulling the rope in the same direction that day, and it worked out well for the patient.
And he literally he had a heart attack. You were able to bring him back, open up his arteries. And how is he doing today?
Yeah, so I actually was looking at his chart yesterday. I think he might be home from the rehab place. So he was discharged from our hospital to a rehab facility, and I think he's home. But again, when I saw the patient, we've, I'm not going to make light of this, but Princess Bride,
Yes.
where there's that scene where he's like partially dead, and I think they're blowing air into his mouth. This was like the most dead I've ever seen anybody, if that makes any sense. And so it was just again something that I will always remember, and it does. It comes into my like that situation comes into my mind pretty frequently when I'm dealing with sick patients. So it was a life changer for me for sure.
Which drives home exactly what I said leading into this, which was it's really about that instinct, right?
Yep.
Medicine requires that kind of instinct that led you to save this man's life.
Yeah, and again, if I would have done something, who knows? Who knows what if whatever, I don't know. I told the gentleman when he woke up, I said, I'm not pushing my religion on you, but I'm just saying, like, I think God has a plan for you, and you need to do something in this life now, and you need to pay this forward. And he totally got that. So hopefully there's something. He's got great things ahead of him. Hopefully.
Well, we appreciate you. And for those who haven't seen that story, you have to go to youtube.com/, the at sign, the way to my heart, and click under the live tab because you really don't want to miss that story. It is so powerful. And it's under the one where we talk about travel tips on Princess Cruise Lines. And we ended up deviating from that
Yes.
conversation to something a lot more powerful and impactful.
And
So
I think what I'd like if, when I see him in follow up, maybe we'll get him on the show and he can be a Save My Piggies guest. So that would be kind of cool.
I would love that. So let's get to Dr. Chen's story, another story filled with instinct driven medicine. But first, a moment of inspiration.
Dr. John Phillips, spectacular, vascular moment of inspiration.
You know, I always look to see how the guests respond to the noise that makes, and Jane's smiling. So I'm going to say my
It's
little
my favorite part.
I know mine too. It just
Doesn't
makes me
get
laugh
old.
like I swear I have the mentality of like a 15-year-old. But at any rate, so this is a quote from Marcus Aurelius. He's one of the most famous Stoic philosophers. I've quoted him before, and I was I was preparing for the quote in the context of Gene's story or Dr. Chen's story. Kind of dealing with having risk factors of diabetes and also being, a podiatrist, so a healer. And I found this from Marcus Aurelius because I think it focuses on what you can control. And so he's quoted as saying, "You have power over your mind, not outside events. Realize this, and you will find strength." Marcus
That's
Aurelius.
really empowering. It's also a little scary because it actually states that you are in control of your body. And sometimes when you have these things happen with illness or accidents that we'll hear about, you feel out of control. But the key is in order to maintain a long-term mental state that is healthy. I mean, it's mental wellness awareness month. You've got to take that control back. You've got to believe that your mind can control how you feel and who you are and what happens to you going forward, right?
And it's similar to when you did the movie, you had the hypnotic that
Oh
was
yeah, the
cool, right?
hypnosis for our New Year's resolution show.
Resolution show, yeah. So
I did have someone who ended up calling into our Leg Saver hotline at 1833 PAD legs and said they watched the show and they used that hypnosis to say, I'm in control of my body. I decide when to stop.
mhm.
And I thought that was so powerful that that moment that we had on that show led to someone walking further and faster and improving their circulation. So you
Awesome.
never know what's going to resonate, right? And I hope that Dr. Jean Chen's story resonates. I can't wait to get started and bring her in. That's next right here on the Heart of Innovation on KDOW. Don't go away.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just step
That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation, what an incredible lab you have here.
Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should because it is a killing disease, it is a disabling disease, and most importantly, it's a disease that we now have great treatments for.
Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I don't even know how to explain it. You're 42 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Hi, everyone, and welcome back to the show. I want to bring in Dr. Jean Chen and really get started with her story. She grew up in Taiwan watching her parents care for patients as an act of service long before she wore a white coat. And she trained as a podiatrist ultimately when she came over to the States because she had a passion for limb preservation. And I'm excited for her to share how she decided on becoming a podiatrist. That's a great story. But also, I look forward to her sharing that life-altering injury that really ended that chapter. And I'm going to tell you that sucked, but it turned out, being a blessing for her and so many patients that she is now helping as a diabetic educator. She found that other way to serve the community using both her training and her lived experience to help others protect their health. So, Jean, welcome. Thank you so much for being here. Appreciating you for sharing your story and all you do to help save life and limb.
Well, thank you for having me. I'm very honored to be here today.
Yes, we love having you. But I want to start from just with that instinct, because we touched so much on it in the first segment here, and where that began for you. What did medicine really mean in your family growing up in Taiwan?
Well, I grew up, my mother is a registered nurse, and my father was a pediatrician in Taiwan. They come from a very poor family. And by the time I was 5 years old, I was very, very sure I want to be like my parents. I wanted to be a doctor. I wanted to help other people. Stories about my parents coming, after World War II. My parents' family went to Taiwan. My father's family went to Vietnam, and not being able to afford medications costed my grandfather on my father's side his life. And I never got to meet him. And how my father went to Taiwan, got a medical degree. And when I was watching him having his own private practice, I saw how he used his own money to treat those who couldn't afford it, because he and mom knows what it's like to be poor. And my father also volunteered after a devastating hurricane in Philippines for a whole entire month. And my mom did something similar too. And I felt medicine is a human right, and everyone deserves to be treated. It shouldn't be based on economic status or power. Everyone should be treated with humility and respect.
Yeah, and so your parents, take us back to when your parents, brought you over from Taiwan to the United States, and how their careers changed here, and ultimately that ended up influencing you even further.
Well, I have a surprise for you, Kym.
Uh-oh.
Today is my 49 years coming to United States. Today is
Are
the
you
anniversary.
serious?
Yeah.
Wow.
Oh, congratulations. We're so thankful to have you here.
I am
That's
so
amazing.
grateful. You have no idea how grateful I am to the United States government for letting us immigrate to the United States. And it is such an incredible journey. We we came on a 747. It was Christmas time in 1976, and we got a letter saying we had to go to the U.S. Embassy. And I didn't know why my parents for a few months were playing records like ABC, and trying to make my sister and me learn our ABCs. And the funny story is, around Christmas, we went to the U.S. Embassy and we were interviewed. And my sister, she was younger. She's 3 years younger, so she's crawling across the desk. The officer who's interviewing us. My mom's trying to hold on to her while she's trying to crawl. And the guy talked to my parents, and then he looked at me and he said, how do you feel about going to United States? And I started singing A, B, C, D, F, G. And then he just pointed at me like this, you're going to United States. And
love it.
And then in a few days later, we got a register letter saying you have to enter United States by January 10th, or you cannot come to United States anymore. And so my parents immediately start calling all their relatives, giving things away, converting what they can to American cash, to US dollars. They bought 8 large luggages. They put blankets, clothing, and plane tickets. We hopped on a 747, went through Hawaii to enter the US, and we landed at LA, and here we are.
I think that story is more, I mean, not to, well, I'd love to get into that further, frankly, if you don't mind. I mean, so your dad gave up his practice in Taiwan. he can't practice in the U.S. without completely starting over, correct?
Right.
Correct.
So he did this for you guys, right?
Yeah.
I imagine. I mean, so your dad's a selfless, and your mom too. So he led by example, and you obviously carried that, or continue to carry that torch as well. I mean, that's an amazing story, and man, that's inspiring. That's particularly in what's going on right now. That what we're hearing in the press, it's inspirational to hear somebody that did it through legal channels and has flourished for many years.
How did your dad, your mom end up assimilating? I assume, as Dr. John says, that it just being a doctor and being a nurse, it just doesn't translate in a very simple sign a document type of way. What did your parents each have to go through, and how did their career paths potentially change in light of it?
Well, we lived in a hotel for a week until we found a 1-bedroom house that my parents rented. And my father initially tried to work in a restaurant, but that wasn't helping him to, have time to study, to become boarded and find a residency in the United States. So my mom at that time decided to work as a nurse's aide. And Toyota just came out with their first car. So we bought the tiny little Toyota, and Mom went to work as a nurse's aide. My father stayed at home.
How old was your dad at the time?
I was 8.5. So I'm assuming my dad was probably like early 30s.
Sure. So, I mean, but he has to go through a complete residency program again and basically start over. And it sounds like he was willing to do that. Did he ultimately do that?
Yes. A year later, we moved to Euclid, Ohio. That's how I was telling you I grew up in Euclid. He actually found a general practitioner residency at Euclid General Hospital. And so he got his 2 years of training. And at that time, my mom was able to pass her nursing exam and continue to work as a nurse at Euclid General Hospital. So after that, my father, after coming out of residency, he decided he did not want to have his own private practice. He felt family is very important. So he also wanted to work with people who are differently abled. So he went to work for the state of Ohio to work with the differently able. And then at nighttime that he's at home watching over my sister and me growing up, because sometimes my mom worked double shift. So he wanted to make sure the family's well taken care of.
And coming up next right here on the Heart of Innovation, we're going to talk a little bit about our mom who ended up in cardiovascular health and how Dr. Jean Chen ended up in podiatry and ultimately altered her career path to become a diabetic educator. That's next right here on the Heart of Innovation on KDOW. Don't go away.
Your type of condition is called critical limb ischemia. It's the most advanced form of PAD, or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to PAD and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair close to 2 years and my husband had to quit work.
I didn't know what to do at this point because we had had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, another toe, and then it was another toe, and then half his foot before he was even diagnosed with PAD.
And all I heard was, "What are we doing here? Just cut it off." And I pulled the curtain back like, "Are you kidding me?"
Do you really want to go through all that?
That's crazy. That's insane. The protocol is to send them to amputation. Always, always, always get multiple opinions.
We do have options. We need to listen more to our patients.
If you're going to chop off their leg anyway, Why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Welcome back, everybody. Thanks for joining us. I would be remiss if I did not thank Reflow Medical for sponsoring what I think is the best medical podcast in the world. So thank you, Reflow Medical. I had a great conversation with Issa, their CEO, yesterday. So if you see a Reflow Medical employee on the streets, give him a hug for us. So anyway, yes. So Gene, let's continue your story real quick. Tell us a little bit about Mom, because Mom was involved as a nurse in cardiovascular care. But then we want to hear how you grew up, went through education, ultimately got into the field of podiatry.
Well, Mom is a coronary intensive care nurse. Well, she's retired now, but she really loved medicine. Unfortunately, when she's at Taiwan, she tested very high for medical school, but they said, "You're a woman, you can't be."
Oh, wow. Back then, no way.
Yeah. So she felt that coronary intensive care nursing would be very challenging. So she got into CICU, and thank God for Mom for saving my life one day. But
did she really? Wait. Don't brush over that. What happened there?
What happened there was that I was having angina and I was admitted to the hospital, and I've been in and out the emergency room multiple times, and I was seeing my cardiologist in New York, and he was trying to get prior authorization through Aetna to do some tests on me. But I texted him one night because he was my attending. So I was telling him, I think I should go to the emergency room. I've been long-term diabetic over 20 years at that time. And I'm having nausea. I'm having some unusual chest pain, but it's not the typical pain that you talk about going down your left arm. But I just don't feel well. I'm vomiting. So he agreed with me, go to the ER. And at the ER, being a woman, you really have to advocate for yourself, because at first I just said, "Oh, it's probably acid reflux," and I said, "No. I want a cardiology consult." And the cardiologist came. I told the whole story, and he admitted me for observation overnight. And I had on and off pain throughout the night, and they were ready to discharge me the following day. But my mom came in and she talked to the doctor. She said, "You can't have her be in and out of the hospital all the time. Why don't you guys do the cardiac cath and really see what's going on?" And
how'd that go over? I can't imagine.
Well, they gave me a choice. They said, "Well, we could discharge you, because if we do the cardiac cath at this hospital, if there's a blockage, they couldn't help me.
They can't fix it." Yeah.
Right. So I said, "Well, why don't you transfer me to the hospital 1 mile down where you can actually do it, where it's a heart center, a Vascular Brothers center, because they can do it. Why don't you transfer me?" So they arranged for the transfer, and it was really funny too. I'm still laughing about it, because I'm there, half nude from bottom down, waiting for the cardiac thoracic surgeon who was ready to do this, and he disappeared. He came in, he said hello, he disappeared, and then he came back in eating a sandwich. I'm thinking, like, I'm hungry too. But he disappeared again.
How candid this is. That's amazing. I know so many patients that are actually nodding right now going, yeah, exactly. Don't eat in front of the patient that's been literally fasting for 24 hours for this.
No, but I always tell patients and their families, I'm like, listen, nobody's ever starved to death at our hospital, and you're not going to be the first one. But I get it. You get hangry. I get it. But that's a good note to self.
So mad about is just that I'm like, okay, can I get this over? Because I'm really scared, because for the first time in my life, laying there, I realized that if anything go wrong, I could possibly die on the spot, and I know my diabetes. I've been struggling with getting the diabetes under control. And that was a scary moment because I don't know what will happen. And of course, they gave me the Valium, and the guy, when he came back in, he just said, "You'll be home tonight." And then partway through, he just said, "You're not going home. You're going to be staying overnight." And the next thing I knew is that a stent was placed into my widowmaker, and it was 80% occluded. So I'm so glad mom insisted on this, because if I had a major heart attack, I don't know if I'm going to still be here.
Yeah.
No, thank you to mom. Oh my goodness.
Thanks,
You know,
Mom.
we always talk about, your family, and if you can't advocate, your family needs to step in and advocate. That's incredible. So you've had it for your diabetes for 20 years. When you were younger, did you have any sort of medical issues that influenced your decision to go into medicine as well, and influenced how you end up treating patients? I can imagine now, as a diabetes educator, that your experience definitely influences your care.
My father, he was a diabetic. My grandfather on the maternal side and my mother, they're diabetics. And so definitely that has influenced me a lot. And another thing that really influenced me is what happened to me in college. When I was at Cornell, I took a year off. During that time, I worked at Tompkins Community Hospital, and I was on the surgical oncology floor. When the patients came back from her surgery,
And you don't want to miss what happened next. So stay with us right here on the Heart of Innovation on KDOW. Don't go away.
When your sugar runs high, it's more than a sign. Diabetes creeping in, it's a dangerous line. Pre-diabetes too, don't think it's too light. It can lead to PATS, so start the fight. Sugar's sweet, but the cost is real. High blood sugar makes your arteries feel clogged. Slow flow, it's a ticking time bomb. Catch it early, stay strong, and keep your legs on. Sugar's not so sweet when your leg is in pain. Not controlling sugar is where peripheral artery disease sets in. Got sugar? Get checked. Don't wait too late. Save your legs, save your life, take control of your fate. Leg pain, cold feet, neuropathy too. These are signs diabetes caught you. High sugar's the link for circulation and pain. Left untreated, your leg might end inflamed.
Welcome back, everybody. The cliffhanger before we went to break. Gene, you were telling us about being at Cornell, so got into a fantastic school, obviously very smart, and you're taking a year off, I believe, and you're working a surgical oncology unit, and something, you had an experience with a patient that clearly changed your life. Do you want to finish that story for us, please?
Yes, she came out of surgery, and when she returned to the floor, she cried in my arm, and it really, really broke my heart, because she said, "I will never, ever square dance again." And what happened was that she developed a foot ulcer, and at that time she underwent a below knee amputation. And that was really difficult to watch her cry, and it broke my heart. I just felt that if this can happen to her, what can I do at that time, knowing that there's diabetes on both sides of the family? I wasn't diagnosed with diabetes at that time until I was 21. I just felt that there should be something that we can do. And sorry.
No, that's okay.
And I didn't get into med school the first time around. I went to Roswell Park Cancer Institute, and I started doing oncology research. And one of the things that they told me is, don't get to know your patients, because I was dealing with T-cell leukemia, and I got to know my patients, and unfortunately, none of them survived.
No, because you're such a good person. Oh my goodness. You just felt for every single one of them.
I
Wow.
really did.
And they still impact you today. And it speaks volumes for your character and why we are so blessed. And every one of your patients is so blessed to have a touch point with you and have you in their lives. So
No.
thank you for all you do.
And that really impacted me. I couldn't, I thought about reapplying to med school and doing MD, PhD, but after that experience with oncology, I'm just like, no, I definitely want to do podiatry because I felt I could save limb. It will affect people economically because we all know what happens when someone loses a limb, you know, and the cost of what it does to them economically, to their family, and to their health and to their mental state. So I just felt podiatry was the right thing, and I really felt drawn to it. And so I was very fortunate that I got into the Ohio College of Podiatric Medicine.
Yeah, there was something that you could
Congratulations.
do, right? You something you could control. And in saving the limbs, you're saving lives. And it probably was really empowering. How long were you practicing though before you ended up being forced into a different career path? And what took you down a different career path?
You mean from podiatry to diabetes education?
Right there.
Well, my second year of residency, someone ran a stop sign and hit our car and missed hitting me by 1 foot, and so I had a severe whiplash. But when you're in residency, you really didn't take time off to take care of yourself. You are more worried about the patients on the floor, and so I wasn't getting physical therapy like I should, or any of the care that I should. But around 2018 or so, like I came out of residency, started practicing 2006. Then around 2018 or so, I started falling, and I didn't know why I was falling a lot. And I started developing worsening of my right foot where it's drop foot. So I went to see my favorite neurologist, Dr. Hughes, and he did MRI and found out the ligamentous flavum, which is in my cervical area, calcified and was starting to fray my spinal cord. And that was that led to my first surgery at New York Columbia Presbyterian Hospital with
So
Dr.
Gene,
Paul McCormick.
so Gene, that was serious enough where they needed, if they didn't do surgery, would you have become paralyzed? Is that a possibility or?
And that's what led to my second surgery, because my first surgery, even though the bones fused, I was still having problem. And we re-MRI'd and found that there was continuing to have stenosis from that. And the day they told me to go back for a second surgery, they were going to fuse 2 more vertebrae. So I'm now fused from
How old were you at the time?
Gosh, I'm 57 now, so I think that was around 51 or so.
Okay. So very young.
Yeah. Yes, the day they found COVID in New York was the day they told me I needed my second surgery. A week later, the office called and said, we can't take you to surgery safely because of COVID. So they said, you're only allowed to sit on your sofa. You could go to the bathroom. You could go to the kitchen. You're not allowed to do anything else. You're not allowed to do housework, nothing. So thank God for my husband who did everything. And by the time they took me to surgery, which I can't remember exactly, it's either 7 or 8 months later, the left side of my body was paralyzed in the sense that I can't really move my left arm. I was moving my left arm, holding it up like this. And I could still walk, but it was with difficulty. So they took me back to surgery.
So you were that tenuous that they said you basically need bed rest or seating rest, whatever.
Yeah.
Wow. Okay. Holy cow. And this is all related to the car accident. Jeez.
Yeah. And by the time I got discharged from my second surgery back home, bedbound for 3 months, my primary care, when I did follow up with my primary care post-surgery, she said, you can't feel your hands very well and you can't really turn your neck very well. Your career as a podiatrist is over.
Wow, what went through your mind in that moment?
It was devastating.
Of course.
It was so devastating, and this is where I really want to let the audience know it's okay to have disappointments in life, but if you are feeling depressed, please get help because um, I I was resistant to getting mental health help initially, but my primary care Dr. Jensen at that time talked me into it, and it really helped in trying to turn your life around to say, okay, this part of my life ended. The depression was really bad, so of course the diabetes got really bad, but counseling helped. My best friend, who is a chef as well, is a diabetic educator and a PhD in nutrition. By phone, she lives in California. Called my husband every day, control my diet, worked with me um, about my diet, and she taught me some the tricks that she used in working with her patients. And these are the same tricks that I'm using with my patients because you know what? I've gone seen diabetic educators before, but getting a handout, it's like, what am I supposed to do with this? I don't know what to do with this. But to actually have real tricks that are applicable can really make a difference in getting your diabetes under control. So I have to thank my best friend, my husband, for being there for me. And my husband did take me to physical therapy. I didn't want home physical therapy because I felt being at a physical therapy place would be they will be more aggressive in trying to rehabilitate me. And I have to thank my husband. Like, he helped me bathe, he helped me get dressed, he took me to PT and helped me walk with my walker. I mean, I'm really grateful to him.
And coming up next, right here on the Heart of Innovation, we'll have more with Dr. Jean Chen and that aha moment that led her to actually become a diabetic educator. So stay with us right here on the Heart of Innovation on KDOW. Don't go away. Do your legs hurt when you walk? Do you feel cramping or numbness that makes you stop and rest? This could be more than just getting older. It could be peripheral artery disease, also called PAD. PAD happens when arteries in your legs become clogged, limiting blood flow. And when blood can't flow, your health is at risk. PAD affects millions worldwide. If you have diabetes, high blood pressure, high cholesterol, or if you smoke or have a history of smoking, you are at higher risk. Symptoms may include leg pain when walking, slow healing wounds, or numbness in your feet. Some people don't even notice symptoms at all until it's too late. PAD is serious. It can lead to amputation, heart attack, and stroke. But the good news, PAD can be treated if caught early. Talk to your doctor. Ask about a simple PAD screening test. Protect your legs. Protect your life. Every step matters. Walk strong. Live long. Get screened for PAD now. For more information, go to padhelp.org or call the Leg Saver hotline at 1-833-PAD-LEGS.
This is our last segment. We've only got a couple minutes left. And like they said in Shawshank Redemption, get busy living or get busy dying. And Jean, you obviously had to come to terms with the fact that you couldn't do what you were doing before as a podiatrist, but now you had an aha moment, I hear, that said, I guess I can do something else. And diabetic educator is what you chose to pursue, correct?
Correct. I was so depressed. My sugar was really out of control. And Dr. McNicholas said to me, Jean, what can I do to help you get this back under control? And I thought for a second, and I said, I want to be a diabetic educator because I don't want to waste my education. And I feel what I have learned as a podiatrist, plus what I have learned from my best friend, I could take this and help somebody else out. Because if I'm talking to a patient, I'm talking to myself to never give up. You just can't give up because life can either defeat you or you could defeat it. So that was the moment. And from then on, when I could walk again, came out of the walker. He paid for my transportation for every Monday for 7 months. I trained with him. I became his diabetic educator. And one day when I was taking my husband to see him at his Manhattan office about my husband's medical concerns, his diabetic educator quit. So he just said, "Are you ready?" I'm like, he said, "Are you ready? Take your first patient." And he hired me on the spot, and I've been with him 4 years now.
And what's been the most rewarding part about being a diabetic educator?
What I love the most is when patients are very early, like in pre-diabetes. I have a few of my patients, they reverse their pre-diabetes. I had a few that gone from early stage type 2 diabetes to pre-diabetes stage, including my husband. So I'm really proud of him that his last hemoglobin A1C is 4.7. We went from 5.7 to 4.7.
So you give, I mean, you give people hope, and I think we only have 2 minutes left, but that is a significant statement that you just made, because there's, I want to say 20 to 30 million pre-diabetics in this country, and they are just a couple of months away from being diabetic. So with help, with people like you and a great physician, we can push this tide back and get people to, keep them out of diabetes. So awesome work. Thank you.
Oh, yeah. I tell patients, I'm on your side. I'm a diabetic, and I don't want you to undergo the hardship I had, being scared, getting a stent in the heart and knowing I could possibly die the next minute. I don't want anybody to have complications, because it is scary, and it is, it breaks my heart when people have to suffer so much.
Yeah, in the last, 30 seconds, to a minute here, this has become not just a job for you. This has truly become, you are mission driven, and you are taking on awareness at a grander level with the American Heart Association PAD Collaborative. Diabetes is a huge risk factor for PAD. In the last few moments here, talk about what, if you could achieve anything in 2026, what would it be?
I would want a presidential executive order to recognize PAD as a threat to our safety, our health, and it's also a national security issue, because if our nation's not healthy, then our country will be in trouble.
Let's get RFK Jr. on this show. Let's do it.
Exactly. Dr. Jean Chen, thank you for your courage. Thank you for sharing your story and all you do to save life and limb. And thank you, everyone, for joining us. If you want to see the after show, go to youtube.com/the @ The Way to My Heart.